In the year 1882, Dr. Robert Cox, on this day, 24th of March, announced that he has discovered the bacteria which was causing tuberculosis. And to commemorate this and to create awareness globally, annually, every year, 24th March is being observed as World TB Day.
This year, around 19 villages will be getting the TB-free award for 2024. So I congratulate all the VTB secretaries for achieving the TB-free village award. The CHOs and ASHAs also have worked very hard to achieve the status of TB-free village in their respective areas. So the credit goes to the ASHAs and the CHOs also. And there are certain guidelines and criteria for achieving a TB-free village award. We have to screen the entire population for TB disease. Then after that, we do testing for 3% of the population. So these 19 villages in the different blocks, they've tested TB, so they are getting the award because they have tested 3% of the population. They are getting the award for TB-free village. And even if TB patients are there in the village, if a TB patient fulfills the 5 criteria, then that village can become a TB-free village. So in the first year of achieving the TB-free village, the village will get a bronze Mahatma Gandhi statue. And then in the second year, they will get a silver Mahatma Gandhi statue. And in the third year, they will get a golden statue. So now, for giving away the award to the VTB secretaries, I request our TBD commissioner to please come over and hand over the awards to the VTB secretaries. This year, I would also like to mention that Zavuku village is the only village which got the silver Mahatma Gandhi statue. Zavuku village got the TB-free village award for the second time. That's why that village is getting silver Mahatma Gandhi statue. Next, I call Luhavi village VTB secretary. Luhavi village. Anyone from Luhavi? Next, Luhaijia village VTB secretary. Anyone from Luhaijia village? Luhaijia village. Asha, any Asha? Tungdemo, please. Next, Nitozu village, VTB secretary. Nitozu village. Next, we have Manmamuk village, VTB secretary. Next, Ahoje VTB secretary. Ahoje. Next, Kokito village. PTB secretary, Kokito. With zero deaths, zero TB disease, and zero TB suffering. The goal of NTB is to end the global TB epidemic below 10 per million population. We have 3 services available: free tests, free drugs, and financial benefits. So these are our objectives: 90% notification rate, 85 to 90% success rate, and a successful treatment outcome for multi-drug resistant TB cases, and to decrease morbidity and mortality in TB-HIV co-infected cases, and to improve outcome of TB care in the private sector. This is the incidence and mortality. I will not go into detail. So this is the infrastructure that we have in NTB Dimapur. We have one district tuberculosis center, 4 TUs or tuberculosis unit. Here TB patients are notified, and we have 11 testing centers in Dimapur district. Dimapur district means including New and Chukudema. So here TB test is done, and also HIV test is done in these testing centers. And we have 57 peripheral health institutes. Here the symptoms and signs of TB are identified. And we have 78 dot centers. In the dot centers, TB medicines are given out. So this is our performance indicator. TB notification rate is one of our performance indicator. The target given to us is 90%. So when we analyze the chart up there, only during the COVID period we could not achieve the notification rate. We have been achieving in almost all the years. Last year we have detected around 1,952 TB cases, and we reached the notification target 91.6%. And this year we have 357 TB patients. And this is the treatment success rate. The target given to us is 85 to 90%. So when we analyze the data given there, we can say that in the year 2021, 22, and 23, we achieve our target that is 85% above. We are not able to achieve 100% because some patients they die, and some patients they are lost to follow-up. So these are the Nikshay Boshan Yojana, or financial benefits given to TB patients. All together during the course of treatment, a TB patient gets around 3,750 together if they are on treatment for 6 months. If they are on treatment for 10 months, then accordingly they will get 10,000 plus the 750 travel allowance. So every month a TB patient is supposed to get 1,000 rupees. So this is our performance chart for direct benefit transfer. Percentage paid all benefits is only 58% for the nutritional support, that is the Nikshay Boshan Yojana. And the tribal patient support percentage benefit paid is 61%. We are not able to reach 100% because many of our patients are not giving us their account number. And even if they want to give open account number, they don't have valid documents, especially the migrants. That's why our payment percentage is very low.
So I will be highlighting about the scenario, malaria, with respect to malaria in our Dimapur district, and also the activities that our program is taking on to control and to eliminate malaria in our district, and also the way forward with regard to what activities or the contribution we all can make in order to eliminate malaria from our district. So our program, that is National Vector-Borne Disease Control Program, we are looking after 6 vector-borne disease: malaria, dengue, JE, Kala-Azar, chikungunya, and filariasis. And when we talk about vector-borne diseases in Dimapur, mainly malaria, dengue, and JE is common. And then today I would want to focus more on malaria. as our program at the national level targets to eliminate malaria by 2030. So in line to that, our national vector-borne disease control program at the district level, we're also pursuing aggressively to achieve this elimination of malaria from our Dimapur district by 2027. So our state has successfully brought down the cases of malaria. Some years back, maybe if we have to take the timeline, maybe 10 years back, there were lots of cases of malaria in Nagaland, but it has come down to just 12 in the year 2024, out of which 7 were reported. That is, the patients, they had travel history to some other districts, to some other states, and they got infected from those states. So 7 were reported and only 5 cases were indigenous. And last year, in the year 2024, Dimapur have had 5 cases of malaria, and out of which all of the 5 cases were imported and none were indigenous. And the last indigenous cases were reported in the year 2022 with 1 PV, Plasmodium vivax, at Medzifima town and 1 PF, Plasmodium falciparum at Kachari town village. So this is the district epidemiological status of Dimapur. So you can just have a look over there. So all of the states in our country with respect to malaria status is divided into 4 categories. Category 0, prevention re-establishment phase. Category 1, elimination phase. Category 2, pre-elimination phase. Category 3, intensified control phase. So we are really fortunate that our state, we are at the category 1 elimination phase, and even our Dimapur is on the same category. So we are working tirelessly to achieve category 0, that is eradication of malaria completely from the district, thereby preventing re-establishment of any malaria cases, that is indigenous cases in our district.
Moi laka namdo Monica Supa se aru moi eta TB survivor se. I was diagnosed with MDR TB in the year 2015. Moi first year Delhi de ha dem de a lot of symptoms to pai shu libi TB kwa do unigena tha nai family de bi ki terbi TB bimar do unigena bi tha nai and ena korigena ki wishina bana bishi jaga de mohan treatment jaina bhal hoigena thaiche to Dimapur e aha bishi libi moi bishi private hospital han de bimar ki ase thuri bole na parigena tha dem de almost 3-4 months do inai west vijeshina kaf laga dawai he khai de issue with ne kafi gina snack na koina to after that moi ta private hospital le jaina treatment lwa dem de do TBSC na koina janishe TBSC guna janishe to TB dawai khai de she to almost 3-4 months TB dawai khai thaka de bi TB to bhal no hai na she to aru next treatment ja dem de do tahandom ke ekta treatment apni laga rekta sputum test kuro lagi boy na kushina to dawai ra effect moha kane to ito test kuro le pathai she to MDR test na to MDR do second stage of TB na, which is a very severe and life-threatening disease. And MDR TB 1 month lagi she report ai hole na kili hole itu tem de do itu test kurala machine do yete thaka nai kushe to 1 month ru kha dem mo ini TB la dawai hi kha dem de do pichide report aha pichide MDR ase na kushe to MDR the second stage hui jabura aro dawai do pishi strong na a very rough treatment and moi the regime lowale ulai jese 24 months kane dawai khawale including a painful injection for 9 months except Sunday 9 months to my everyday injection mari deise and then in a day around 14 tablets khai deise moi dawai na to 24 month ina khawale lagya dem de do of course I have moi pishi duk paise gau de be physically be moi pishi weak hoise mentally be moi weak hoise on top of that already gau de pishi duk pai na tha dem de the main issue do stigma na mohan itiabi bhal ra awareness na thaka karni the misconception that TB is a cursed disease no hishe kulibi TB do biya bimar biya kam kurigena lagi na gi kinaha kona HIV bi mohan misconcept asina biya kam kurigena HIV bushi kuda pat mohala dimak de biya hoigena hi na bimar lagshe idunishna TB bi na mohan manuhan kubole sorom lage moi TB ase bushi kuda manuhan muje kin lage wana ki na hoigena na but then moi private hospital de luckily private hospital de treatment lwa din de dawai do bishi expensive lagi for a middle class family like us bishi burden bishi financially bi to doctor bra moike DTC de refer kurishina apni han afford kurole parwana nai dawai do ena bishi to expensive bishi will be so be nijo bacha ki do bachiule diwole man jai na so my family they said yes mohan de to expense to uthawole paribo ena bishi and then half 24 months dawai khawle lage se injection man bishi lole laga din de do 15 days kani dawai lua de bi almost 20,000 china ulai de to 1 month la lole ula de bi bishi jai and then one sputum test MDR test kura do 10,000 na ina ekta test kura bishi expensive type to itu doctor bra moige bishi bhal bra explain kuri na DTC de jabi government khan ra free treatment aro dawai khan bi so free ase na aro government la dawai bi bishi bal ase but then we mohan wanshina we always prefer paisa dige na kinya la do e bhal ase free bra pa la do biya ase we have that misconcept mohan la bapna na government la dawai do we don't trust like we don't government school de education bhal na pai do na private de bacha hange paisa dige na pura to he bachahan education bhal pawo inam hala mindset thaka pura we mahanbi government medicine to all of doubt kuri jeshina kini bili free bra diase to kinna bhal hobo na but then doctor pura bishi bhal ba mahan ki bujai na DTC de refer pura bishi once I was referred to DTC mahan ek taka bi phikaule lagya nai na I have to go through many tests moi test khan pura din dibi yati civil hospital refer kuri de doctor is also here Dr. Pangarna tai pura refer kuri na test khan bi so free de dawai khan bi so free de and doctors were very supportive
aman so ponishe aman abi kobolibe kunai we have heard from the patients from those recoveries thank you Monica and also my two friends we are there to support you and we'll be there always to support the patients and count on us so that in case of anything apunian duk pai bi aman lo dia bi aman apunian lo dia se koina idu chane dia se yati aji UN bra message team digana world tuberculosis day 2025 day yes we can end kwa aman so pase it is not only the patients it is not only the medical fraternities that will end this TB patient. Olibi yati kiman jun na yana se aman sop laga hat aman sop laga involvement lage na itu kurile hi aman itu bimar do aman dunia ra hatai di bole ase yati saile commit aman sop commit kurobo lage na commitment aman pra itu thaibo lage aji yati boyena we have to commit ourselves that we will end this disease and will remove this from our places then invest thakaran idia madam bra akidi question amala speaker bra edu TB patient edu nutritional support 30 June kiman the sponsor kuri ase question so like those are financially sound poisa thakaran edu han taihan bi invest kurbo lage edu aro we will deliver amount sob manu milai na edu deliver kuriena patient kan ke support kurbo aro bimar manu bhal hoise bole do aman edu dunia bra TB do hatabo edu ase aji today we are here I've been talking about all these things because aman stigma ite aman patient kan proba that is the real life experience I have nothing to say although aman bi edu hunigana whether at our level na aman bi tai discriminate kurishina purana and itu taken ki charishina charana. Instead of helping them, itu amahan taken ki alak separate position of running. Today we are very fortunate to have only like today actually World Tuberculosis Day we are celebrating, but our doctors in charge they have given very good representation covering all the diseases, TB, OB, vector-borne diseases, OB, nutrition, immunization programs, especially for children, HIV issue. This is the main diseases which is affecting us, our society. So I think one important, I think this those who have come here, yati ajikiman etin kurina se, pishi mano idu informative ekta learn kurina thakbo bhabi ase. And especially I would like to request the VTB secretaries, village councils, kiman chunai kina se. This message should go to the grassroots level. Apne ajiki hunishe idu grassroots level di loi jayena. Itu message to kishe bole public can be learn kurbo or public can be understand kurbo. Today we know like government is investing lots of money. Khali treatment in hoy poila to hospital de jalibi tawai loglibi tawai na thaki. They will refer doctor can bra pharmacy de refer kurbo pharmacy bra logol. Now today you see puisa bi diya ase tawai be free of cost diya ase. What can government give? Itu body government bra ki dibo na. And we should amahan idu janibo lagi that government is giving all these things for the treatment. And if we are just sitting idle, bimar hogena jani gana, ami itu suspect ase, ami lao bimar itu ase bena aman itu benefit to naloi gana thakile do, it is our own loss, na aman our own loss. Aro government bra itu policy kili ase bole. See nowadays it's puisa holibi, it's not given in cash. So, अपने लगा account transfer करी. It is everything is accountable. तो tomorrow department की पैसा दिगना से ना आजकल तो common लगा system इनका से financial year की अपने अकाली कोसों March 31 दे आएगा 31 till 31 CMO account की पैसा तो use कराने बोले common बड़ा वापस ले लो. So they will think that Nagaland itu, normally itu Dimapur district itu TB bimar nai, na, till mani puisa use nokori do, tawa use nokori do, inaga hobo de, next time aman mangilibin nabo, it was it. So I think awareness from our side, aman level by awareness people itu, bishi important as it, because there are different, ajikali social media ada different issues, can be like, I was in Chalugi 2022, 21, yeah, it one them day, Rubella virus injection nation, na. Itu lah school di China. Bishi posti manu district immunization officer bishi to pasi. Taikan jalibi kita ini. Ay boleh nanti vaccination boleh na. Why? Kumba asam laga kuti itu marina bimar asibena foto viral puri jai. Actually itu bimar laga, itu vaccine mara laga itu salah. So they are today aman kimam bhal kam kure ase, biya kam kuru boleh bin itu against kura manu bi bishi lagi. I think we should know that this false information spread kurado aman itu tackle kuru lagi. And whatever government is doing, definitely they won't do for itu public ki pya boli boli no. Everything what government is doing, it is for the betterment of our society. Amala baca kan next generation kan kini ka bimar itu kan natori kena itu thakibo. Taikan health Phal hoy kena uthibo na. Health is wealth condition. Aman health tik thakile, if we are healthy, we will economically grow. Our society will grow economically. Because bimar thakichu bole aman kiman income pabo itu treatment di jabo do hospital di bera dan di jabo na tawai kini bole di treatment bera dan di puisa thakabi jabo. When our health is okay, when we are healthy, when we can do something. Itu kurishe boleh do aman puisa bhi pabo and this will help us economically. Bacakan study guru boleh parbo aman ki lagi itu pabo itu asing itu bra. I won't take. I think I'm taking much time, but ami ko boleh itu monase and definitely we are there as a district administration. We are behind you all the health workers. Pustikan boleh bhi itu amami sob miligana hat ekta China. Itu kali aji TB hi noy boleh bhi vector-borne diseases itia koa nishna malaria, typhoid, dengue khan nishna it one pi hata bole tai ki dikhaise amahan itu as per medical advice it one kam kuri jaile amahan it one bimar kan asti aman life pra amala chakra hata bo aman aron aman yadi kiman jun ase itu healthy pra thakibo perena time dia kani ami bi man tak koi this. Thank you so much.
जी एकटा वैसब्रा बाहागी वैसे गरान इगुल रिपीट नगरिमो the chief medical officer and the staff we have already born again amaran ekdam Jesus loi loise ido office do open ase we try to be approachable kiba tok ase bole do any ramahebi or especially postidi holibi sub center di holibi kitia tok hobo gobi within 1.5 hour to 2 hour itu majune punching na takibo wala additional apna ahibo rokibo nabarebo aru next day abo inekala kano hai ajikali olo zamana to change ho jaise itu bra we want to keep our distance closer we are for you whatever possible ase ki bari ase phat jawab de debo ki na bari ase false promise diripo or yes we can understand we are very fortunate to have very smart my friend as a TV officer in the district Dr. Benchilo Dr. Porinihi ito so success way ase she's very sincere when a classmate ase ito daily kam dishe bele do hoishi mihin kori na ito kirai itu beramakan survive boys. Itia nyati terlalu supporting staff orang lagi na achi iman success hoy boleh dia bisu bayase. Aro itia most importantly, I pay my respect to our sister Monica and our another daughter. Among respect dia sendiri. We appreciate your firm decision. Like the up down guribo. Aro ekila para bokeh do ono pura muk pura amara partner kuri ase amara mora support ase bo holibi na side effect topa pikha homa bole da bara no time to your and your alone yes ini garan ta amara ki mano ase ki man dan ase to chani chai achido you all are living witness na itu bishi ba ase. Thank you so much. Already 19 villages plus. Among Kiman, aji award paise. TV laga aro bimar laga niyam to bolo alak ase. Itu among football killer nishina ase. Iti among score korise. Olibi ini dagi chokoli to aro abon number aro score koi jabo. Itu nishina aji TV free village laga award paise olibi. Itu maintain kore bola ni. All the next year to Tajibra, she source which will go. That means we have to keep our standard going. Aro, Tuida Kamdo, maintain your standard. Plus, tell the good news to the other villages. Now, Yati, the VTP secretary means representing entire village council. I want to thank you. That is CHO. And nurses, I want to thank you. Tadi Asha se, I want to thank you. And tadi supporting staff. Ki bahal kam kuri se, itu japode. Ara ako nakan iniga kam kura namji, to kweshi boli do, please let us know. Aro paisa kumpa throw nukura tamja makan olam mom bikaya se. Itu TV kam naga nutritional support wali sindip. Kipa paisa olam ase kweshi boli do. Secondly, Nolorina sign word is yes, it will be much. The second point though, Yadi Malaria obviously very smart. Tartagado Amantis or Pishilabase. Ito salbi amakan Malaria loko chuchi boliase. Ito salbi amakan Kobal Biawali dengue to Ayuliase. 2023 24 Hana. 25 day high chance ase. Ready? Ready. Tarbara logina mahan hilibo or the DTC bra mahan ke support edibo. Ekdam mahan kia hai shi bolibe ma bhari bolishna bhabi ase. Yes. Alright yaro amakan Dr. Rongson na immunization laga program bishi bal jaya ase. Bishi bal jaya ase amakan kimban kurish bolibe immunization do fail hoishi bolido generation ta gap ola hone ase. Itu kuradan de every ward, every villages, every health worker, every person in that particular area support yaro bishi chani ase. Iti amakan tai ko ase head count kuri na jawo ase. Itu bishi idea pala ase. Matha do 1 2 goina. Kile mane kitawa kompa do na masabi hali boli chance hone je to ram no boli head count. Ekbar do jai she. Bishi to ase. Itu house adan de moram brother nge kali ni dibide. Ek kursu dini amna kan aisha ro mane to sir party or achieve aise na no bola. Please, please, if you love me, please treat my staff who are going to enter your home. Please treat them nicely. Aru ki hobo? Head count thik hoise boli do micro planning hobo aru itu sabya makan kam to bishi pa jabo. Itu ase. In addition to that, I want to thank our MS, the KV. Idi amagan HIV, man amagan score mark balbaruna. Mostly though, 80 to 90% though, ICDC, civil hospital hoy, or remaining though outpost hoy. So I want to thank you for your contribution. Around HIV though, we are getting good mark, but we are also controlling. Tawai we think khado ARDC vertical ase itu bra itu kan bi kon kam kore ase itu kan bi thanks dia ase already achi olok program campaign hwa do pador ekta bra chira noi charna mare ase. Time is precious, no? Thank you everyone. I wish you a very good remaining day. Thank you so much.